Hey guys, this is Dr. Jean-Guy, and today this video is for you. If you haven't taken advantage of it yet, it's time. If you're a late adopter, it's time to jump. I'm just telling you, it's working, and it's working amazingly. Some of you have heard of our new technology that we have at the office. It's called SoftWave Therapy, and I want to tell you a little bit about it again, because now we have months behind our belt having this machine, and it's been just amazing. The technology comes from Germany. It started back in 2005. It's been in the US for over a decade now. Only major universities have used it in professional sports, like the Mayo Clinic, the Cleveland Clinic, the Pittsburgh Steelers, and so on and so forth. It was on the show The Doctors. It was called the Future of Healthcare, and nothing short than amazing to see the results of what we've had so far. It's been truly amazing, and I want to tell you what it does, right? So we call that SoftWave Therapy, or TRT, which is also known as tissue regenerative therapy. And what it does is, number one, is it will increase the blood flow into the tissue by 300%, anywhere between 200 to 300%. That's number one. Number two, it will take the old cells and it will just recycle them, get rid of them. And then last but not least is it will stimulate your own stem cells to migrate to the area so your body can start healing the way that it was designed for. I mean, just think about that. It stimulates your own stem cells. So the condition that we've been able to handle so far, which has been pretty amazing, is anything from head to toe. It has to do with a joint. So if you have problems with your ankles because you've sprained them a lot, or you have some plantar fascia, we can help with that. If you have problems with your knees, whether you have degeneration in your knees, or you were told that you're bone on bone, or you have meniscus problem, or you have ligamentous problem, this has the ability to help with that. If you have problems with your hips, with your lower back, with your neck because of degeneration, we can help with that. If you have problems with your shoulders, and you were told that you have rotator cuff problems, or you have weaknesses in the muscles, we can help with that. If you have problems with tennis elbow, with golfer's elbow, with carpal tunnel, we can help with that. If you have any kind of degeneration or arthritis in some joint, we can help you. Which is pretty amazing that I can't say that, because I've seen it now, and it's just amazing to be able to see, and to be able to see people shortly after they start care on a program to get better. So the reason, the way that this works is, how we do this is we first do a mapping session. The mapping session is really important. And what we do is we want to find out the area, the problem area. And then we're going to do a consultation, then we're going to do a brief exam, and then we're going to do your first session, your mapping session, which is a mapping session also known as a discovery session, because we want to find out if we can help, right? If we can't, then we can't. But if we can, we'll be able to tell you based on how you're showing up and what you've been through, and what does that entail. So that is the first thing, is we're going to do a mapping session. Number two is, I tell people all the time, I'm like, listen, the reason why we do this, because I've got a heart for people that I just have they're at the end of their rope. Too many people I've seen having injection, cortisone, shot, pain management. They've done this over and over again. They're just on the verge of, if it's you having a surgery, or maybe thinking about surgery, having shoulder replacement, knee replacement, or whatever that might be. Or this is just something that is interfering with your life, that you don't have your quality of life, that you can't play with your kids, or it's hard for you to do the sports that you want to do. Maybe you want to get back into running, or maybe you want to just go on a walk with the dog, but you don't feel like you can do any of those things. So this is designed to give people their quality of life back. And that's the reason why I am really excited about being able to offer that to our patient and in this community. And as of now, nobody else knows besides our patient and in our office, that we have this amazing technology, because we haven't been able to keep up. And I just want to make sure you're not missing out on it. So usually our first visit, when people come in to have the mapping session and the first evaluation, it's usually $300. But because we started this year and I want to do something special for our patient first, I want to make sure that, we do this first session, this mapping session, for only $49. So if this is you out there and you're just like, I saw this months ago, but I wasn't sure, I'm telling you, this stuff works. It's worth trying. And once you get your mapping session, you get your evaluation done, then we can tell you if we think we can help you or not. Fair enough? So just call our office, 517-336-8880, 517-336-8880. And I'm just looking forward to connect with you and then find out if we can help you. Take care.